Hello, everyone. Welcome back to another episode of Able and Disabled. Today, we're going to talk about cerebral palsy. As you all know, Sev has cerebral palsy, um, and she got it by getting sick when she was a baby. Um, let's begin. What is cerebral palsy? Cerebral palsy, or CP, refers to a group of neurological disorders that appear in infancy or early childhood and permanently affect body movements and movement and muscle coordination. CB is caused by damage to or anomalies inside the developing brain that disrupt the brain's ability to control movement and maintain posture and balance. The term cerebral refers to the brain, and palsy refers to the loss or impairment of motor functions. Cannoli just went outside. That's the noise you heard. In some cases, the areas of the brain involved in muscle movement do not develop as expected during fetal growth. In others, the damage is a result of injury to the brain either before, during, or after birth. In either case, the damage is not reversible and the disabilities that result are permanent. Ba, 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 ba. There's different types of CP. There's like 5 types of CP or something. What? You want to add something? There's spastic, which you have. Trying to fix your hair down. This type is the most common form of this disorder. People with spastic cerebral palsy have stiff muscles which cause jerky or repeated movements. There are different forms of spastic cerebral palsy depending on the body parts affected. These forms are spastic hemiplasia. This type affects the arm, the hand, and sometimes the leg on only one side of the body. Children with this form may have delays in learning to talk, but intelligence is usually normal, or often is nonverbal. Um, Spastic dysplasia. People with this form mostly have muscle stiffness in the legs, while the arms and face are less severely affected. Intelligence and language skills are usually normal. Spastic chondroplasia. This is the most severe form of cerebral palsy, involving severe stiffness of the arms, legs, and a floppy or weak neck. People with spastic chondroplasia are usually unable to walk and often have trouble speaking. This form may involve moderate to severe IDD as well. I need a haircut. It's crazy. Dysychinic. This type involves slow and uncontrollable jerky movements of the hands, feet, arms, or legs. The face muscles and tongue may be overreactive and cause some children to draw or make faces. People with this type often have trouble sitting straight or walking. People with dysatic cerebral palsy do not usually have intellectual problems. Atastic cerebral palsy. This form of the disorder affects balance and depth perception. People with astatic cerebral palsy walk in an unsteady manner and have hard time with quick or precise movements such as writing, butting a short, or reaching for a book. And then there's mixed types. This kind of cerebral palsy includes symptoms that are mixed of the other types. Um, what else do you want me to talk about? Do you want to just like what are the early signs? Yeah. Infants with CP frequently have developmental delays in which they are slow in learning to roll over, sit, crawl, or walk. Decreased muscle tone can make them appear relaxed, even floppy. Increased muscle tone can make their bodies seem stiff or rigid. Children with CP may also have unusual posture or favor one side of the body when they reach, crawl, or move. Sev's also super strong. It's so strong. She can choke someone out. But that's just like the stiffness as well. You can also, people with CP also have spasms. Sev has spasms, but they're not as severe as they once were because she has a device called a backflip pump that's on the side of her stomach, and it's it goes in up her spine and has backflip, which helps spasms. They think because I have CP, endo is worse. Yeah, I think because they're like the whole body's stiff and like your muscles contract in your stomach, and that isn't great for endo. Um, so much fun. Younger than 6 months of age, the head lags when you pick them up while they're laying on their back. They feel stiff, they feel floppy. Their legs get stiff and crossed or scissor when you pick them up. Older than 6 months of age, they don't roll over in either direction. They cannot bring their hands together. They have difficulty bringing their hands to their mouth. They reach out while with only one hand while keeping the other fisted. Speaking of pain, pain. We also need to eat something soon. Other than 10 months of age, they crawl in a lopsided manner, pushing off with one hand and leg while dragging the opposite hand and leg. They cannot stand even when holding onto support.
Especially with that form of CP.
Yes. Uh, um, Who's more likely to get cerebral palsy? Cerebral palsy is caused by abnormal development of part of the brain or by damage to parts of the brain that control movement. This damage can occur before, during, or shortly after birth. The majority of people have congenital cerebral palsy. They are born with it, though it may not be detected until months or years later. Possible causes of congenital CP include genetic abnormalities, congenital brain malfunctions, internal infections, or fevers, or fatal injury. A small number of individuals have acquired cerebral palsy, which means the disorder begins after birth. Some causes of acquired cerebral palsy include brain damage early in life, brain infections, problems with blood flow to the brain, or head injury. In many cases, the cause of cerebral palsy is unknown. The following types of brain damage may cause its characteristic symptoms: damage to the white matter of the brain, abnormal development of the brain, ah, sorry, bleeding in the brain, severe lack of oxygen in the brain. It's okay, little boy. It's okay. Something just fell. It's all. Yeah. Cannoli is here to say hello. Do you want to say hello, Cannoli? Ah, things are falling. Come on. Come on. Hello, handsome boy. You're so silly. You're silly boy. Yes. There we go. Good boy. Um, there are medical conditions or events that can happen during pregnancy and delivery, Jesus, that may increase a baby's risk of being born with CP. These risks include low birth weight and premature birth, multiple births, infection during pregnancy, exposure to toxic substances, female parents with thyroid abnormalities, intellectual disability, excess protein in the urine, or seizures. There are also medical conditions during labor and delivery and immediately after delivery that act as warning signs for increased risk of CP. However, most of these children will not develop CP. Warning signs include breech precipitation, complicated labor and delivery, small for gestational age, jaundice, seizures. And it's like not can happen, but it's not like probably like less than 1% of that happening. Um, how is cerebral palsy diagnosed and treated? Mm, no, you don't want me to say that. Why? Oh, you do. I'm confused. Most children with CP are diagnosed during the first 2 years of life, but if a child's symptoms are mild, it can be difficult for a doctor to make a reliable diagnosis before the age of 4 or 5. Doctors will order a series of tests to evaluate the child's motor skills. During regular visits, the doctor will monitor the child's development, growth, muscle tone, age-appropriate motor control, hearing and vision, posture, and coordination, in order to rule out other disorders that may cause similar symptoms. Although symptoms may change over time, CP is not progressive. If a child is continuously losing motor
It's
skills.
not really trendy.
Well, yeah. If a child is continuously losing motor skills, the problem more likely is a condition other than CP, such as genetic or muscle disease, metabolism, metabolism disorder, or tumors in the nervous system. Lab tests can identify other conditions that may cause symptoms similar to these associated with CP. Neuroimaging techniques can detect abnormalities that indicate a potentially treatable movement disorder. Treating CPs. Cerebral palsy can't be cured, but treatment will often improve a child's capabilities. Many children are able to manage their disabilities. The earlier treatment begins, the better chance children have of overcoming developmental disabilities. There's no standard therapy that works for every person with CP. Referrals to specialists such as a child neurologist, development practitioner, ophthalmologist, or oncologist aid in more accurate diagnosis and help doctors develop a specific treatment plan. Once the diagnosis is made, a team of healthcare professionals will work with the child and parents to identify specific impairments and needs, then develop an appropriate plan to tackle the core disabilities that affect the child's quality of life. Um, my endo, however, is treated very much.
My endo, however, is treated very much.
Therapies, physical therapy, usually in the first few years of life. It's a cornerstone of CEP treatment. Specific sets of exercises like stretches, resistive or strength training programs, and activities can maintain or improve muscle strength, balance, and motor skills and prevent contractures. Spinal braces may be used to improve mobility and stretch spastic muscles. Occasional therapy focuses on optimizing upper body function, improving posture, and making making most of the child's ability. Occasional therapists help individuals address new ways to meet everyday activities and routines at home, school, and in the community. Recreation therapy encourages participants in art and cultural programs, sports, and other events that help an individual expand physical and cognitive skills and abilities. Parents of children who participate in recreational therapies usually notice an improvement in their child's speech, self-esteem, and emotional well-being. Speech and language therapy can improve a child's ability to speak, help with swallowing disorders, and learn new ways to communicate, such as using sign language and or special communication devices such as a computer with a voice synthesizer, which is an eye gaze or iPad. And some people with CP can't use eye gazes. Like Greta can't use an eye gaze because it just depends on like eyes and stuff. Treatments for problems with eating and drooling are often necessary when children with CP have difficulty eating and drinking because they have little control over the muscles that move their mouth, jaw, and tongue. And then there's like drug treatments, which is a whole thing. Assistive devices. Um, there's also like other things that come with CP, epilepsy, which Sev has epilepsy, but she hasn't had a seizure in like 10 plus years or something. Um, Incontinence, medical treatments for incontinence may include special exercises. Osophia, Osophia. Children with CP are unable to walk, risk developing bone density, which makes them more likely to break bones. Vitamin D can help promote bone health. Pain can be a problem for people with CP due to spastic muscles and the stress and strain of parts of the body that are compensating for muscle abnormalities. Some individuals may also have frequent or regular painful muscle spasms. Drug treatments such as diazepam, etc., baclofen, have been shown to ease pain. Some people with CP use new non-invasive and drug-free interventions such as disruption, relaxation training, biofeedback, and therapeutic massage to treat pain. You, you have a baclofen pump, yes. There's also they've done like studies on it to see why this had happened. No one really knows why either. Still, yeah. Oh, messages. Okay, I think that is all for this episode. Yeah, we were supposed to. I think it was supposed to be Liz's episode this week, but on is it next week? Okay, that's it. We can figure out something for that spot. It's okay. Um, but there was an error with recording, so that is why. Now, I hope you all enjoyed this video. Don't forget to like, comment, and subscribe. Do you want to add anything, Bobby? No. Yeah, that's all. Stay pink and yellow. We'll see you all next time. Bye.